We'll make that the main camera. We'll always talk to that one. That one's not even getting your face.
All right. Okay, so I'm going to show you how to do the session on a man, and of course it's going to be the same thing on a woman. Except on the woman, you're going to have the section down here that he obviously does not have. So we're going to start. I'm going to start at the top and just kind of work my way down. You can start anywhere you want to, as long as you do, this half in the amount of time that you have to do it. So my sessions are 45 minutes, so I'm going to do 20 minutes on each side. That gives us the time, like I said, before and after the session to measure. And you can feel with your other hand, how hard or soft this is. Because like I said, this is going to soften up and then harden back up, tighten back up. I'm assuming that you all know how to strike a tuning fork. I use my hand for this because I'm sitting so close I don't have access to my legs. But I strike it, put it there, and I wait for it to run out. You can do this in the same spot as many times as you need to, because you'll feel the difference as you're doing it.
So where does the fat go?
So where does the fat go? When you're doing these sessions, you'll actually, about halfway through the session, you'll start to hear the stomach growl and make a lot of noise. And the fat is actually going right into the elimination system, and ultimately you poop it out. I've had people send me pictures, so just so you know what to expect. It's yellow, looks pretty much like fat, and has a terrible odor. Yes, clients have sent me pictures.
Is it usually from the abdomen area, or is it the other area?
It is usually from the stomach, because that's where you're going to see the biggest dramatic effect, because you have the most fat there.
Will I experience weight loss?
Yes,
After this
you
session?
will experience weight loss. But instantly you're going to see inches lost. And then, of course, the weight loss is going to come after you get rid of it, after you eliminate the fat. Does that hurt?
It's a little bit tender.
I want you to feel how soft that's getting.
Oh, wow.
Okay. I'm not sure if you can see it on the video or not, but this side's very soft now where I've been working. This side's still very hard. And I can hear his stomach now. Already. It's pretty quick.
Will this cause any bruising?
The bruising, it just depends. The stomach, the bruising on the stomach, some people experience it, especially if they have a really hard stomach, and they already have all that pressurized stuff in there, and then you're just adding a little more pressure. Sometimes you do get bruising, but it's only the first time that you work on the stomach. The most of the bruising that you're going to see comes from the tissue, the different type of tissue under the arm and on the inner thigh. And if you feel your own arm there, the tissue just feels different than it does anywhere else. And usually you get a lot of bruising there. But there's a few things that you can do to kind of ease that. We'll talk about that when we get to it. If you are worried about bruising on the stomach, you can wrap it. you can use a wrap. You can use Ace bandages, like the Ace wraps, or you can use plastic wrap. Really, whatever you want. Put an extra layer of clothing there. If you're worried about the stomach bruising, you can do any of those things.
So your clients would want to be fully clothed for this?
Yes, our clients are fully clothed for all sessions we do.
So if you're working on the legs, they probably shouldn't come in shorts?
If they come in shorts, you're going to have to cover them up or wrap their legs. Don't do it on their bare skin.
Can I use an extension on the tuning fork or jump foot?
You're going to get the best results if you do it just like this. Just the tuning fork. We need to go straight in. We need to go as deep as we can. And the extensions and the gem feet seem to dampen it. It kind of makes it spread out instead of going down. And now I'm just going up the side. Because, you know, when you lay down, all of this kind of falls. We have all this down here that fell down here. So we want to make sure we get rid of that too.
Could I move the client onto their side if I'm working on like the left side or the right side?
Wouldn't do you any good. If you roll over to your side, all of this is going to fall to the other side. This is the best way to do it. Just have them lay on their back. We do have a sessions, people come in for back fat, and you can work on that too. It's probably not something that we're going to cover here, but you work on it the same exact way.
How do you know?
People come in with the, you know, the big things here, and you work on this the same way that you work on the stomach here.
How do you know how far apart to place the tuning fork from the previous placement?
So I'm placing it, you can probably see the little dots, but at about, I don't know, about 1/4 of an inch, 1/2 inch. And just here and there, everywhere. You're gonna feel it. You're gonna feel it. Don't go by protocol. Don't go by she's pressing it here, then there, then there. Actually feel what you're doing, because you're gonna feel it. Sorry. You're gonna feel it. Like I said, loosen and tighten up, and that's what you want. You don't want to leave yourself in a box and not do a good job, because everybody's different.
So it was tender where you were just pressing on me. What does
Down
that
here?
tell you as a client? What does that mean for you?
This down here is tender on him, and I can actually, this is probably a different video, but I can actually feel his stool impacted
It's okay.
right there, and it's causing him some pain. I can actually feel it. Not so bad on this side, but right here, especially, right in here.
You know, what does that mean when
So-
you're doing a fat burning session? And
I would probably ask my client, you know, do you have a problem with constipation? Or, you know, or do you go to the bathroom okay? And I can usually spend a little extra time right here, and it'll fix that.
like right away.
Yep, like right away.
I'm heading to the bathroom after this.
Like you're heading to the bathroom after this.
So you're. What if there's stretch marks or C-section scars down in this area too?
So that's one of the side effects, good side effects, of doing these fat burning sessions. Is this is going to get rid of stretch marks. It's going to get rid of scars. It's going to get rid of scar tissue. So say if you have a C-section scar, appendix scar, hysterectomy scar, whatever it is, you're going to have to be a little careful in those areas, because it is breaking up the scar tissue, and it stings. It does sting in those areas. You could try it. You could try it for yourself, but if you're going to know it when you put it on one of those scars. But if you don't put as much pressure there, and give yourself time and gradually work on that, you'll get rid of that. It'll go away.
Is that a separate session, or if they come in for fat burning, would you schedule those for 2 separate sessions? Working on a scar, or
Yeah, we're not gonna
doing fat burning?
we're not gonna spend too much time on a scar. Of course, we're going to hit it when we're doing the fat burning session, but they probably need to schedule a different appointment for that, just so that with the time that we have, we can focus on the fat burning. That's what they came in here for. The more time we focus on a scar, the less time we are focusing on their fat burning. And as you can see, it's repetitive. One after another, for the entire 20 minutes. We're going to do this whole area, and we're just going to keep doing it. And if you can see if you can see the pressure I'm putting on this, I'm going to try to go here where the camera is so you can see. I'm actually pushing it in until I can't anymore. We're not jamming it in. We're gradually pushing the fork into the stomach until it won't go anymore.
What if the client has fibromyalgia or like body-wide sensitivity, and it's just too much for them with pressing in?
They have if they have fibromyalgia, first of all, we probably shouldn't be focusing on fat. We should probably be focusing on something else. But definitely, if you wrap them with fibromyalgia, it's going to help tremendously. It may even take away the fibromyalgia in that area, the pain from the fibromyalgia. And I don't know if you can hear it, but his stomach is making a lot of noises.
When you're wrapping, you're just going to wrap the spots that you're working on during the session?
Sometimes. It just depends on what the client wants, what the client pays for. I can do a full body wrap and then just do the session, the fat burning session on your stomach. I can wrap just the thighs and just work on the thighs. So that's a fat burning session. We're just going to keep going. We're just going to keep doing this. I don't think we probably need to tape the whole 20 minutes. As you can see, there's already a huge difference from one side to the other.
So is there a minimum amount of time that you should be doing this? I mean, you said 20 minutes.
I've given people 10-minute sessions. You can do it as much as you want to, as long as you have the time for it. Whatever they're paying for, whatever you are allowing time for. If you're working on yourself, you could do it for 4 hours. You know, whatever you want to do.
If this was something where you were working on their pain and you got that resolved in their 45-minute session, and then you had 5 minutes left, would it be worth it to do 5-minute fat burning?
A lot of times what I will do is, a lot of people don't know about this. Nobody knows about this fat burning session that I do. So a lot of times they'll come in for pain. So I will take care of their pain. And, a lot of times they'll come in for sciatic pain, which I can get rid of in 15 minutes. And then I still have 30 minutes left. So I will ask them, instead of hurrying them out the door because their pain's gone, I may spend a little extra time and say, I do fat burning sessions too and anti-aging sessions. Would you like to try one? Let me show you what it can do. And in 10 minutes, you can do quite a bit. See if you can tell the difference in the sides of your stomach.
Yeah, it seems smoother over here and not as tight as it was over here. I can feel a difference in the consistency of the skin.
And I can see it. It actually looks kind of like it goes like that. Hopefully you can see it in the camera too. The side's very much down a whole lot more than the other side.
Can you talk about how you're holding the tuning fork to have consistent pressure all the way through 45 minutes? Now you're not holding it on the stem like most people do.
No, if I held it on the stem, okay, let's see what it would do. Yeah, you're not getting it. I'm not. I don't have any control. That tuning fork is going wherever it wants to go, and I have no control over the pressure, the consistency of it, or anything. If you hold it like this, you have total control over the tuning fork. You can put it wherever you want. You can press as hard as you want. You can put it at angles. There's no way you can angle this anywhere. With this, you have total control. You could angle it any way you want to, and you're going to need to angle it for the side boobs or the boob lift and different things. When you get down here at the bottom of the stomach, you're going to want to put it at an angle and kind of push up.
So you said no extensions or gem feet, but what about the extended bases on the tuning fork?
I wouldn't use anything. I call this barefoot, and that's the way I would use it. I would not put anything on the end of the tuning fork to do this session.
The ones with the longer stems, what about those?
And the ones with the longer stems, I don't have very much experience with those. But I would think that as long as you held it here instead of down here, you'd have a whole lot more control. That especially with the longer stems, you're really not going to have any control. So I would definitely hold it up here. Longer stem, I don't know. I don't know what that would be good for, because you have to hold it, this way in order to get the results that I get.
Do you have the client get up halfway through and look in a mirror or anything?
No, actually, it's so dramatic that, especially with the women, that when you're done with this side, when you get up to go to the other side to do the other side, you can tell your client, or you can do it yourself if you're working on yourself, but you can tell your client, go ahead and feel the difference between the sides, from one side to the other, and usually it's just like, oh my God, I can't believe it. So, yeah, you'll get this side done, and it'll be obviously noticeable. It's obvious the difference in the sides. So a couple more things that I want to talk about is we talked about bruising. I want to talk about heat. Sometimes the more stubborn stuff, which is going to be like the belly fat, if you warm it up, it goes away faster. So you can use like a heat pack or heating pad, whatever you want to use. Wrap. That's going to help the tuning fork. I don't know what I'm trying to say. You're gonna have to cut that.
Yeah, it's going to help the tuning fork melt the fat and.
It's kind of like when you put shortening in a pan. It's solid until you warm it up, and then it kind of liquefies it. It gets thinner, and that's going to help get rid of it. But you don't need it. You do not need the heat. You don't need the wraps. You can do it just like this, and you're gonna be very successful.
But there's also the fluids that are in there besides the fat. You're not just removing fat. You're doing what you're doing in pain relief as well, right? You're removing fluids that are built up there too.
That's right.
And that works well with heat. Now what about, we get this question a lot about topical lotions or things that create heat. Things that you would rub on as in a lotion form as a heat generator.
For pain?
Could be, yes.
Icy hot?
Like icy hot. or biofreeze or whatever it's called. So what would you say about those, the heated lotions?
Well, I don't use them just simply because it's not going to take away anything. It's not going to get rid of any inflammation. It's going to make it feel better for just a little while, and then it's going to be back even worse because all you did was cover it up for a little while. So I wouldn't, I mean, I don't use those anyway, but they're not doing anything as far as getting rid of inflammation or pain. They're just covering it up. And I'd rather get rid of it so it doesn't come back.
Is that enough heat for fat burning?
Icy hot?
Yeah.
I've never used icy hot for fat burning. I don't like the chemicals on the skin. Maybe I should try it. I don't know.
How long will this fat burning last? That's a question we get asked often.
It is a question that we get asked, but it really doesn't make any sense because we're getting rid of the fat. You're actually putting the fat into the elimination system and you're getting rid of it. So how long it will last? Until you put it back there again. But this fat's going to be gone.
How long do I have to wait before I can have this done again?
I can do this every day. You can do it to yourself every day. You can do it to yourself a couple times a day. And with clients, it's however much they can afford for you to do it. So if you guys are playing along with your tuning fork, you should have seen a difference by now. So remember I told you it was going to get loose and then tight again. So feel your stomach now. So it's getting tighter.
Mm-hmm. Yep. It's not as squishy going in. It's almost like the skin is tightening up.
Right, exactly. That's exactly what it's doing. It's all tightening up. So that's how we do fat burning. With a woman, you know, like I said, you're going to do, there's the belly button, you're going to do belly button above the belly button or below the belly button for the 20 minutes. If you want to do the whole stomach, and if it's you and you're doing your whole stomach, spend some time on it. Because I spend 45 minutes on just this top section. So you're going to want to spend, 45 minutes on each side if you're going to do the whole thing on yourself or a client. So really spend some time and do it the right way. I wouldn't try it doing 10 or 15, 20 minutes to start out with. Really do at least 20 minutes on each side to get the results that you're looking for. Stretch marks. You can, if you want to work right on stretch marks, I still wouldn't use the gem foot or anything on the tuning fork. You can work on the stretch marks right through the shirt, and a lot of times if they're really bad, you can feel them through the shirt. But you put the tuning fork right on them, and you're going to press just like you did with the fat burning. And you can do individual stretch marks if you want to. Some people have them pretty badly down in here, in this area. Just be careful. Don't press too hard because it's going to hurt a little bit. It's going to sting. But yeah, you can just press right into the stretch mark and it will disappear right before your eyes. Same way with the varicose vein. With the varicose vein, you need to use a gem foot. Just so that you don't, usually the tissue is very tight on the back of the legs, and that's usually where they are. and it's a lot of times it's caused from too much fluid in there, and it's already really compressed in there, so you have to be careful. So I would use a gem foot in that area, and you do it the same way as the stretch marks. You just put it on that varicose vein. You just put it on that varicose vein and just press, and it's going to take care of that. You may need to do a couple sessions, but probably not more than that. You're going to see a huge difference after one.
We haven't talked about issues that, in addition to constipation and things, digestive issues, but there's a possibility of you feeling a hernia or something down in the lower abdomen. Can you talk about
Yeah, and then
possibilities of hernia?
that's one thing that would stop me from continuing with the session. Well, it would stop me from starting a session if they. That's one thing you want to ask them. Make sure you ask your client if they have any hernias or history of hernias before you start the session. And you're also going to want to feel yourself. You see me doing that all through the whole time, is kind of pushing in and feeling. If you feel anything like that feels like it may be a hernia, you should probably stop and send them to their doctor. Down here is a good place for men to have hernias, down in this bottom area. Women tend to have theirs more by their belly buttons and things like that. But yeah, if you feel anything that feels like, some sort of anything that feels like it might be kind of sticking out or anything, you may want to have them see their doctor about that before you continue. That's one thing we don't work on those. There's nothing that we can do for those except make them worse with our tuning fork. So definitely look for hernias and don't go any further if you find one until they get that fixed.
Are we able to cover the thighs in this one, or you want to stop it?
We can do thighs.
The camera's positioned properly?
Okay, so I think that we're going to do arms first, though.
Okay.
So now arms, a lot of women are really concerned about their saggy arms. So it would be this part here, this part, and if you feel this tissue here in the saggy part, it feels different. It feels different than this or this. It really feels different than anything else. This and the inner thigh. So you want to be careful when you work on this. Let me do a quick go. This is going to bruise. If you don't wrap it, if you don't take extra precautions on this, it's going to bruise. And it may even bruise anyway, even if you do. Depends on how compressed this is. Andrew's is really compressed in there. So we're just going to get this flatty part here. You lay your arm. And we're just going to kind of push into it and up. So we're going to push in and up. And make sure you can see on this camera over here, put this arm up. So we're going to push in and up. And by up, I mean towards his face. Be careful, don't push in too hard because it does hurt there. It's very tender. Before you do this on a client, I would definitely do it on yourself. But that's going to firm up very quickly. And you're just going to do it, all of this saggy stuff. And just remember, when you lay down, it falls down back there. So you want to make sure you do the stuff that's laying back here. You're just going to push. You're going to go in and up, up. In and up. Now the hard part is muscle. You don't want to do that. You just want to do this squishy stuff.
How much time do you spend on each arm?
It really depends on the arms. You can, because you're going, like I said, don't put yourself in a box as far as like time and protocol, because all these are all different. You know, you don't have very much at all. Like this right here is already tight. The saggy stuff you had is already tight. So I don't need to spend any more time on this. I can go to the other side and do that, and we still have time to do other things during the session. But if you know, I've had 80-year-old women come in to see me, and their arms hang down to here. I do 20 minutes on each arm. I do the whole session on just their arms. So really, it depends on the severity of the saggy arms, how long you're going to do it.
Do you measure the arm
Yes, absolutely. You can measure.
circumference?
You can measure before and after, right around the arm. You just measure right around the saggy, the part that you're going to work on. Measure right around it, before and after. It's going to be a huge difference. Same way with the thigh. The thigh and the arm are exactly the same. So, you know, if you're really worried about tissue bruising, definitely wrap it and wrap it again. Wrap it 2 or 3 times if you need to, because this is going to bruise. This area is going to bruise. Same way with this inner thigh. With the top of your thigh, this area way up at the top, this is that same type of tissue. You're going to feel it, and it's going to feel different than this, or even this. Area is going to feel different, and this is going to bruise, just like this up here. So you're going to wrap it, or you're going to take extra precautions, whatever you need to do, and it's going to be more tender, just like the arm. So we're going to put it in and up. And by up, I mean up towards his head again. So we're going to push it in and up. And it does hurt there. It's very sore. It's sore just to touch there. In and up. And remember, do this on yourself before you try it on a client, so you can see the pain level and how much you need to press. In and up. And you'll feel it. You'll feel it get tight right before your eyes. Excuse me. Everybody's talking about that thigh gap. You can do those. Give people thigh gap. You want a thigh gap, honey? No. So you're going to go all the way back. You can even kind of bend their knee out, just kind of like this. A little bit. So that you can get right back there. Get the whole thing. And if you bend their leg out like this, it tightens it up so you can actually see what needs to be tightened and what's kind of the squishy stuff.
Should you tell the client ahead of time that they're going to bruise?
Absolutely. And that's why you should do it on yourself too, so that you can actually see how much, you know, how tender it is, and if you bruise, so that you can tell your client, because you know, you don't want them to call you and tell you, I'm all bruised. That is all tight now. It doesn't take very long to do these areas. The bigger, of course, the bigger the squishy spot, the longer it's going to take. But usually it's just more contouring and firming it up. But that's all you do. In and up. Feel where the squishy spot is with your other hand, which I'm not feeling very much now. Oh, we've got some right there. Right there. So we go in and up towards his head, not up this way, up that way. Squishy right there. That's all there is to it. Outer thigh, you don't have to be as careful with the outer thigh, because it's you know, you don't have that same tissue there as what's here. The only thing that you have here that you need to be careful with is the IT band that runs down from your hip to your knee, and that gets kind of sore, and you can feel that too. It feels like that big rubber band in there. You don't want to put it too hard on that. That's kind of sore. But you're going to do the same thing with the outer thigh. You're going to in and up. I usually start at the hip and work my way down to the knee. This is just kind of contouring. We're going to smooth it all out and go with the shape. So we're just going to get rid of all the loose stuff all the way up. That's body contouring. And usually I do body contouring on people's, like, their butts. Butt is a good way to do contouring.
Can you talk about lipodema? When you work on somebody who could come in for contouring, or
Hopefully you know the difference between somebody that's fat and somebody that has edema or lipedema or lymphatic problems and just have a lot of extra fluid. Hopefully you can tell the difference between those things, because that's a totally different kind of session. So we wouldn't do this to get rid of edema or fluid buildup in someone's legs with neuropathy or any of that. It would be a different type of session for that.
the lipodema with the fat accumulations of fat, the large accumulations of fat in the lower extremities.
Mm-hmm.
You worked on somebody with lipodema
Yes.
On this part.
Right, and that's a different type of session. It's where the fat accumulates differently, and it accumulates in clumps and clusters, and usually it's like right under the butt on the top of the leg, and it's a different session. That you wouldn't consider that a regular fat burning session. You would do something different with that. That's something different.
Can you tell the difference by feel?
You can tell the difference by the way it looks. People gain weight everywhere. When you're just big right here, that's not right. That's something different besides just your fat.
Okay.
Okay.
Do you want me to flip over?
Yep, we're gonna do the butt and the contouring on the back, and we're gonna be all done. So one thing we're not doing is we're not going to change the body shape. We're just going to get rid of all the fat and everything so you can actually see the body shape. So when we work on the butt, of course, some things back here that we could do too are the top of the thighs. We could when I do thighs, the inside of the thighs, usually I will do the back of them a little bit too. But like I said, you can feel the squishy stuff and the hard stuff. You can tell the part that doesn't need to be worked on and the part that does. So with a butt, we're going to just define it. We're going to go around it and outline it. So we're going to start by actually seeing where the outline is. And we're going to go right around it. Same amount of pressure. We're going to push down until we can't push anymore. We're going to go right around his butt. Right around, just like this, the shape. And this is actually contouring as well. Again, we're going to go in and up. In and up. In and up. We're also going to do up here, because we're going to do the outline of the whole butt. So we're going to go up right here around like this, and then we're going to go across. So we're going to get some of this off the hip here. That's when you lay down, your butt ends up here on your hip. So we're going to go right around and do the whole thing. In and up. Always up towards the head. In and up. And you can actually see the butt lifting up.
And show it around the other side real quick.
I will. In and up. Okay. So what we're going to do is right around the butt. We're going to go in and up. You can see the outline. In and up. In and up. Let me show you my other hand so you can actually see the butt lift. And up. Up towards his head. In and up. This is also going to take fat off the sides of the hips too. In and up. You know, we don't really have much fat here when we stand up. So all of this squishy stuff that you see here, this is all butt. When you lay down, it just kind of fell to the side. Kind of like the boob lift. It's the same thing. One side effect of the butt lift is lower back pain's gone. Really eases the lower back pain. So you can see the top of the butt is here, but we still have all the squishy stuff up here. So we're going to go right along the top. We're going to use a little more pressure here than we've used down where there's tissue. This is bone. We're going to use a little bit more pressure here. But again, it's going to kind of be the same because we're going to press until we can't press anymore. And continue to go all the way around. When you get up here to the top, you just can go straight down. You don't have to go up. Although when you do it, you can see that we will pull the butt up. Go in and up, and the butt actually lifts. So. And like I said, this will help with lower back pain. Hip pain. I can still hear his stomach.
Better hope that's my stomach.
Yes, we all hope that that's his stomach. And as you can see it's very outlined now. The shape. I didn't do down here yet though.
Is that another 20 minutes on both sides?
Yes, the butt is a session all by itself. These are it really just depends on the severity of it. You know, you find a lot of people that don't have very much, and the skinnier people are really more receptive to the forks. I mean, not more receptive, but it doesn't take as long to achieve the result with a smaller person. So you're gonna find you can do a lot more. You can do maybe on a smaller person you could do the arms and the thighs, or the butt and the thighs, or just whatever your time allows you to do. Just make sure you're thorough and you're feeling that it's working, that it's tightening it up, and it's not all saggy and loose and squishy. That's what we're trying to get rid of. That's the whole point. So when you find an area this is pretty tight, but this right here is still kind of smushy right here. So we're going to go over here and work on this. And it really is, everybody's different. So you're not going to be able to, do two things here and then come over here and do these two things. You need to work on it until this is going on him. Tailor it to each client or yourself. If you're working on yourself. I'm not sure how many of you are going to use this on yourself or you just want it for clients, but hopefully you try it on yourself first. But that's the butt. You just go all the way around and that's it. You do have a muscle that comes down, right down like this. So we're going to do that. We're going to go down the inside of it like this. We're just going to go all the way down and we're going to push in and pull up. In and up just like before. In and up. This will not bruise. The butt will not bruise. You should not have bruising when you do these sessions. If you do, you're pushing way too hard.
Now you mentioned this before that this is a side effect is lower back pain sometimes resolves during this time. But can you point out the fact that sciatic nerve runs along the same route you were just on?
Sciatic nerve kind of starts like right in here, right in the middle here, and you'll probably feel it. It'll probably be a little harder and stiffer than the rest of it, but yeah, that's where it's at, right in the middle there.
And where it crosses the butt where you were just at, that same route is where it crosses, right?
Right, but if somebody comes into you with sciatic pain, that's a different session. Don't do a butt lift session for sciatic pain. So you're going to feel a ridge here. It goes all the way across, and that's where where your outline's going to start. If you don't know where to judge it, you actually can feel the outline of it up here at the top. Again, we're going to go right down that inside of that. You'll feel it. It'll be harder there. We're going to do lift, in and up, every time. In and up. You'll see all this lift when you do that. You'll see all this down here lift. And that's it. All there is to it. So the bruising is the most important thing that I can think of, well, besides the hernias. So the bruising is going to be on the inside of the thigh and the underneath of the arm. So just, really be careful when you get to those areas. Wrap them if you need to. Wear extra clothing if you need to, whatever you need to do to not bruise so much there. You will only bruise the first time, maybe first time or two there. And then after all of that pressure is released, you won't bruise there anymore. So you can work there as freely as you want to then. And with the stomach, you may get a little bit of bruising if you have the hard, tight stomach. You may get a little bruising because you're pushing into that compression already. It's already compressed. But then again, at the first session will be the only time you would bruise on your stomach. If you bruised after that, I would say you're pushing too hard. You're pushing way too hard. Some people get back fat. They get this roll right here on their back. I'll show you real quick how to get rid of that. Again, your back should be tight. Your whole back should not be squishy and loose. So if you get to a squishy spot, it needs to be tightened up. So a lot of people get that this right here, and you're gonna do that the same way, in and up. This should not bruise at all. You should not get any bruising at all, and it really shouldn't even hurt that much. I mean, it shouldn't be that sore at all. And again, in and up. And you'll get some people that have great big places here that need to be worked on. Just be careful, take your time, and do it that way, in and up. You can't try this on yourself, on your back, but you have bone there, so be easy. Just don't push in too much. But it's the same way, and you can go all the way up. If somebody has a fat back, you can go all the way up, in and up, in and up. It's going to tighten everything up. You can also go up the sides for contouring. All of the squishy stuff we can tighten right up. So as far as how much time you allow yourself on everything, and how much time you're spending on all of that just depends on how long your sessions are and how much time you want to spend on it. Just make sure you do both the equal amount on the same side on both sides, so you're not lopsided. In and up, in and up. And that's it. That's all there is to it.